Hi, this is Dr. Karen Becker, and today we're going to discuss canine leptospirosis. Canine leptospirosis, lepto for short, is caused by at least 4 species of infectious leptospira bacteria, or serovars. And we know that there are actually over 20 different serovars in existence that could potentially infect your pets. Leptospira are found in both domesticated and wild animals. The main carriers of the bacteria are rats, pigs, raccoons, cattle, fox, skunks, and opossums. In recent years, we've seen an increase in canine lepto cases, probably due to better diagnostics, not necessarily because more infections are actually occurring. And so it's important to know that while leptospirosis is not a new disease, in fact, it's been around forever, but in fact, the number of cases that we're documenting is probably increasing because we're encroaching more and more on natural habitats, and family pets are coming into contact with wildlife known to harbor the bacteria. We also have better diagnostics to be able to identify the disease. The leptospira bacteria is transmitted through urine, which contaminates water sources and can remain infectious in soil for up to 6 months. Dogs pick up the bacteria through a cut or a break in the skin, or when they drink from contaminated water. Dogs most at risk for leptospirosis are those that spend a lot of time in water or in areas that get rain or snow runoff. Also dogs that can tend to drink from puddles or ponds. Many dogs with mild lepto infections never show any symptoms. Generally speaking, young dogs tend to get sicker than older dogs, and clinical signs depend on the age and the health of the dog, as well as environmental factors affecting the bacteria, as well as the virulence of the particular serovar of the bacteria that your dog may have acquired. When symptoms do occur, they usually show up between 4 and 12 days after exposure, and the symptoms can include fever, muscle pain, vomiting, diarrhea, loss of appetite, lethargy, depression, and blood in the urine. Dogs that become seriously ill with a lepto infection must be hospitalized to receive antibiotics and appropriate supportive care to control the vomiting and diarrhea, as well as provide hydration and nutrition. Dogs with more mild infections can be managed at home as long as the owner takes appropriate hygiene precautions when cleaning up dog urine. Dogs love warm, humid climates and are often found in stagnant water. As I mentioned earlier, wild animals can also harbor the bacteria, so dogs exposed to potentially contaminated water sources, as well as wild animals, are at a much greater risk of developing infections than, let's say, city dogs. Infection is most common in the summer, early fall, and during flooding. At home, you can cut down the risk of infection by safely controlling the rodent population in and around your home. If you happen to live where leptospirosis infections are real common, obviously keeping your pet away from ponds, slow-moving water, and sitting or stagnant water is a really good idea. Now, that being said, I have a warm, stagnant cesspool of a pond that wildlife love to come and visit, and my dogs love to swim in every day, all during the summer. I'm pretty sure that my own pack has absolutely been exposed to leptobacteria, but because I keep their immune systems healthy and because I'm very alert for any symptoms of lepto, I'm not overly concerned. This is what I tell my clients. If you have an amazingly healthy dog that suddenly gets a fever, becomes lethargic, clearly went from vibrantly healthy to not doing well at all, possibly urinating excessively or urinating bright, fresh blood, you need to call your veterinarian immediately and obviously do a lepto test. Lepto is a totally treatable bacterial infection, and it's only when a diagnosis isn't made early enough that dogs can suffer unnecessarily from this bacterial infection. There is a vaccine for leptospirosis, but I absolutely don't recommend it, and I certainly don't carry it in my hospital. It's a relatively weak bacterial vaccine that is short-acting and can't protect against all 20 serovars of the leptospira bacteria. In fact, it's actually ineffective for the current serovar that's causing the majority of infections in my particular area. Because the vaccine is a Bactrin, which means it's a vaccine made for bacterial infections, the vaccine contains a strong adjuvant to elicit a strong immune system response. Because of this, it also carries a significantly greater risk for adverse reactions. Information has recently emerged that the vaccine can actually be one of the causes of the actual disease in dogs, and the vaccine has been linked to early kidney failure in older animals. I feel, because my profession is testing for this ancient endemic infection more frequently, that we're finding more positive animals. And because of this, we're stirring a tremendous amount of fear and anxiety in pet owners over this particular bacteria that is far from a new risk for your particular dog. In fact, it's been in the environment all along, since the beginning of time, and most dogs that don't live in rural environments don't have an increased risk of exposure. But vets are still promoting repeated vaccinations for all pets, despite the huge vaccination risks. Most importantly, it's a totally treatable bacteria, so my question is, why would you ever vaccinate for something that's 100% treatable? I've treated about a dozen cases of lepto in my career and have never had a dog experience any lingering problems from the infection. So I recommend in general that you skip the vaccine. If you live in an endemic area like myself, make sure that your dog's immune system is strong, and if you want, you can take extra precautions to make sure your dog doesn't have an opportunity to be exposed to the bacteria. Now, if you're like myself, you let your dog live a free and happy existence, playing in every pond that they find, in Mucky Creek, and simply recognize that it's our job as pet owners to stay alert for the signs of infections. And certainly, if your pet does begin exhibiting symptoms, that you promptly address those symptoms immediately should they present themselves.